Francisca Afrikaner is a regular at the Epako Cemetery in Gobabis. On the day of our visit, she buried her older brother Augustinus, who died from COVID-19. The previous week, she was here for Christine, her mother-in-law, who succumbed to the coronavirus. A week before that, she buried her niece Sissy, her death also due to COVID-19. Losing 3 family members in such a short period is heartbreaking, but what traumatized Afrikaner the most was the death of her mother-in-law, who passed away in her arms at home.
She asked for water, I gave it to her and she just continued staring at me in silence. I asked her why she was looking at me like that, but she said it was nothing. A moment later, she calls me, take a few shots of breath and dies.
The family then called the police, but Afrikaner claims what happened afterwards was even worse.
The police came to the house, provided 2 male relatives with gloves, and the family had to remove the body and load it ourselves.
Afrikaner claims that the family received a call 3 days later stating that the deceased had tested positive for COVID-19. She alleges that it was the last they had heard from the Ministry of Health. It's been close to 3 weeks with no psychosocial support for the family, she says.
It's painful because the ministry is not contacting us, the household was not tested for COVID-19, and you don't know whether the entire family is safe.
According to the standard operating procedures for management of COVID-19 and related deaths at home as provided by the Ministry of Health, the police should handle the body with full personal protective equipment, and infection prevention and control practices should be adhered to. The standard operating procedures state that a surveillance team will contact the family to initiate contact tracing. Environmental health officers will also contact the family about infection, prevention and control. A social worker will also contact the family within a few hours for an appointment and to explain the COVID-19 burial procedures. Even though Afrikaner says her family is still waiting for a call from a social worker, the Regional Director of Health, Maheke, says it's unlikely that they still have not received any support.
Any family member that died either at home or at the hospital, the social worker is the first person that either the doctor or the social worker, those are the first people that get in touch with the family. And from there, they offer psychosocial support, and throughout they even organize all the burials. The interacting people are the social workers.
Frances Shahama, NBC News, Gobabis.